So at this point, we have looked at classical conditioning and instrumental conditioning within the context of aging in both humans and animals. Now we're going to focus primarily on learning in humans. And the protocols that are typically used in studying human learning are protocols that involve what we call verbal learning. And verbal learning is the process of acquiring associations between verbal stimuli, such as words or numbers, or in special cases where we're trying to eliminate the role of meaningfulness of the stimuli, we could use stimuli like consonant-vowel, consonant trigrams, or CVC trigrams. Usually they're pronounceable sequences like ZUL, ZUL, or TUD, TUD, so to speak. And those CVC trigrams don't have any meaning associated with them, and so they have a special role in verbal learning research. So let's establish, number one, that there's very clear consensus in the experimental psychology of aging that there are demonstrated age-related decrements in verbal learning performance. It's very, very clear that the depth and the speed at which we can learn new materials changes as we grow older. We can still learn, but we learn differently and more slowly. And despite the fact that we have this demonstrated age-related decrement in verbal learning, the size or the magnitude of those decrements are very, very situation specific. So much of the classical work on aging and verbal learning is focused upon understanding the nature of these situation-specific factors that modulate the magnitude of the age-related declines in verbal learning. And to the extent that we can control those factors, we can perhaps mitigate age differences in learning in a variety of contexts. So some of the primary factors, or the most important factors that have been identified in study that modulate these age differences in learning performance, are pacing effects. These are effects that have to do with stimulus presentation speed and the time available to actually make a response in a learning situation. Another factor, as we see on the slide in front of us, that's important is overarousal during experimental evaluations. There's evidence that older persons might be more situationally aroused or show situational anxiety during test assessment, and that may cause an artificial, if you will, decrement in their demonstrated learning performance. And then finally, we need to consider a factor that's been considered in a number of studies, that is the stimulus meaningfulness of the verbal stimuli that are employed. And the fact that the meaningfulness of a given set of stimuli can be quite different for an old group than for a young group. And perhaps these differences can explain why in some cases we see smaller differences between the young and old observers. In other cases, we'll see larger differences because of inherent biases in the stimulus meaningfulness for a specific birth cohort. So let's begin by taking a look at stimulus pacing effects. The experimental psychologist Canestrari compiled a large, if you will, opus of evidence that external pacing of stimuli might not give older people sufficient time to respond in typical assessment situations. And that the upward limit of the older learners was constrained by their response speed rather than the actual amount that they may have learned. And evidence for this supposition includes things like the fact that there's universal slowing in reaction time as we grow older, but also there's this special case that we see in the errors that are made by older learners compared to younger learners in experimental evaluations. It's the proportion of errors of omission that are made by the two age groups. When young people tend to make errors, they tend to be saying the wrong things. They commit an error. Whereas many of the errors, perhaps the preponderance of the errors we observe in older learners are errors of omission. That is, they don't say anything, they fail to respond. And there's a interesting theoretical and practical difference between this proportion of commission errors that we make versus omission errors. So the fact that older learners make more omission errors suggests that they might not be having enough time to respond in the particular evaluation situation that's being looked at. So Canestrari devised a classic paired associates learning protocol that could be used to directly assess the effects of pacing on age differences and verbal learning performance. And he did a number of studies on this in this area. I want to talk about what I think is the most interesting study that he did. But before we do that, we need to look a little bit more at the details of how a paired associates learning protocol works. And that's what I'd like to show you in the next few slides. In a paired associates learning situation, we start off by giving the learner a list of paired stimuli that go together. So in the list you're seeing in front of you, the paired associates are moose, it goes with laser, office goes with frame, phone goes with license, clinic goes with editor, meter goes with chart, etc. In a typical study, we might have 12, 16, 18 such pairs that have to be learned. And the way it's typically done is you're shown the list of pairs one time first, and then in each successive trial, you proceed by beginning with a response interval where you show the first word in the pair. In this case, it's moose. And if you recall from the list we saw earlier, there's a certain word that's associated with moose. And so during this response interval, which might say be 3 seconds, you have to either say laser, the correct word that goes with it, or you make an error of omission. You make no response, or you make an error of commission. So we have the response interval. That's when just the first stimulus is shown. And you have to report what its paired associate is. And then that's usually followed up with a study interval. That might last, let's say, for example, 3 seconds. And this gives you a chance to study the pairing that moose goes with laser and try to consolidate that into your memory. Try to learn that association. Then what would happen is you'd be shown the first word of the next pair, in this case, office. And now you have, let's say, 3 seconds to give your response during the response interval. And if you recall, the word that goes with office was frame. And then so on, you go down the list, you're shown the first word in the pair, you're given 3 seconds to respond. If you don't respond in time, you make an error of omission. If you respond correctly in time, you're correct. If you respond incorrectly, you make an error of commission, and so on and so on. So the important things we wanted to take home from that demonstration was that the paired associates stimulus presentation can be divided into 2 separate components. The response interval, where you're shown the first word in the pair and have X amount of time to make a response. And then the study interval, where you're shown both words and have some time to study that association and to try to strengthen the association in your mind, if you will. So let's see what Canestrari did in his classic experiment to look at pacing effects. He had 2 groups, young and old groups. These were healthy individuals. He had 16 paired associate stimulus pairs, and he held the study interval constant at 3 seconds. So when the 2 words were showing up on the screen simultaneously, so you could reestablish or strengthen the association, that always lasted 3 seconds. What he varied in his experiment, that's highlighted up here on the slide in front of us, is the response interval. And he either gave people only 1.5 seconds to respond before they switched from this response interval to the study interval. That's pretty fast. That's not much time to respond. Or they were given 3 seconds to respond. That's somewhat typical of a paired associates experiment. Or interestingly, they were given all the time they needed to respond. So there were 3 response interval conditions, if you will. The 1.5-second response interval condition, the 3-second response interval condition, and the self-paced condition. So now we can ask ourselves, what happened to the size of the age-related decrement in learning when the response interval conditions were changed? So we can begin by taking a look at what happened in the young people. And you can see in the young people, the response interval condition really had no impact on the number of errors they made during the overall learning of the 16 paired associates. Apparently 1.5 seconds was plenty enough time for the young people to respond, because there was no difference when they were in the 3-second condition or when they were in the self-paced condition. So essentially we would interpret this flat curve for the young people as being indicative of the fact that their learning performance was not limited by the timing of the, if you will, the time available to make a response. However, we see a very different story when we look at the data from the older people. We can see that the response interval condition had a profound effect on the older participants. When the older participants only had 1.5 seconds to respond, they made massive numbers of errors, and the size of the age difference was quite phenomenal. And as you might guess, many of the errors they made were errors of omission. They simply didn't have enough time to respond. When the response interval was increased to 3 seconds, that size of that age difference dropped dramatically, and the older decrement was significantly smaller. And interestingly, when they were in the self-paced condition, the gap between the older and young persons became the smallest. There was still a significant difference there, but it was quite small. Quite a reasonable decrement was observed in that particular situation. And what's particularly fascinating about this result that Canestrari presented was he actually recorded the times that the reaction times of people to respond in these different conditions. And when the reaction times of the old people under the self-paced conditions were compared to the reaction times of the people in the moderate, if you will, pacing condition, the reaction times are very similar. It's like essentially somewhere on the order of maybe 3 seconds, 2.8 seconds, so to speak. And the fact that the reaction times really didn't differ suggests there's something about the fact that the stimuli are presented at an external pace as opposed to the response being controlled internally, where the older person has control and can manage the situation. And so one of the things that this experiment suggests, and what has been substantiated in future experiments, is that older learners and older performers in most contexts do best when they can go at their own pace instead of the pace that's being set by the external environment. So that's a good rule to sort of stash away to remember in terms of doing any design or program optimization or planning when older learners are involved. Now, another factor that's been implicated in modulating the size of the age differences in verbal learning performance that we observe is the factor of arousal. And for a while, there was a little bit of a controversy about whether older learners might be under-aroused, under-motivated, or they'd be over-aroused, sort of have a little bit of test anxiety, so to speak. So let's take a look at some of these ideas. We have to begin with this classic law in experimental psychology, and that is the Yerkes-Dodson law that we see here. And what the Yerkes-Dodson law expresses is this complex relationship between the amount of physiological arousal that's taking place in the individual being evaluated and their performance. And what we find is when we go from very, very low arousal You could think of it as being low motivation or whatever. As we go from very, very low arousal to intermediate levels of arousal, we see our performance actually getting better and better and better as arousal essentially increases until we reach this sweet spot, this optimum in the curve. And then interestingly, after that optimum point is reached, if arousal gets any higher, we begin to get diminishing returns. It actually results in a situation where the increased arousal begins to degrade performance. And so we can see this inverted U type function. This is a classic function used in many theories in cognition and in social psychology, motivational research, etc. So for many years, it was assumed that the learning differences and other types of performance differences we see in older persons coming to the laboratory to be evaluated, that these differences, the effect of arousal was such that older people were undermotivated, they were under-aroused, and they would fall in this, if you will, low arousal, low performance part of the essentially arousal performance function, the Yerkes-Dodson curve, and that young people were optimally aroused and therefore would perform optimally. So we would call this the sort of the under-arousal assumption that older persons are less motivated, they don't try as hard, they don't work as hard in the experiment, and that contributes to them not doing as well as young people. However, a researcher at Duke University named Karl Eisdorfer and his associates described many different characteristics of age-related learning studies that suggested that, if anything, older people were actually over-aroused in the laboratory evaluation setting rather than being under-aroused. And they saw signs of anxiety. They saw many types of many proportions of omission errors in their learning data, so to speak. And that's not only associated with pacing effects, but also associated with, if you will, anxiety and over-arousal. So Eisdorfer conducted several classic experiments that were designed to demonstrate that indeed older people were over-aroused in learning situations, and that if you can manipulate or reduce that level of over-arousal, you might reduce the size of the age difference in learning performance. So let's look at a couple of the experiments that he conducted. Let's look at his first experiment. In his first experiment, what he did was he took simultaneous measurements of learning performance on the one hand and the level of physiological arousal that his participants presented with in the laboratory. So he had young people and old people. They were given a learning task. He looked at their learning performance, but he also looked at how physiologically aroused they were using, it was actually a blood draw and a chemical that was measured in the bloodstream that showed the amount of sympathetic nervous system activation in the individual participants in the study. And so for every person in the study, he had a learning score, whether they were high, low, or middling in performance, and he had an arousal score, where they fell in the arousal, if you will, continuum. And when he plotted that data, he found results similar to what we see in front of us now. The young people performed very well in terms of learning, and their arousal level was kind of right around the sweet spot. The older persons, on the other hand, instead of their arousal being low down here as under-arousal or under-motivation assumption would suggest, they were instead at the high end of the arousal realm. And also their scores, performance scores on the learning, were lower. So they fell on this leg of the Yerkes-Dodson curve instead of the lower leg. And that is consistent with the idea that the older person's learning performance was modulated downward because they were over-aroused instead of under-aroused. And that's reasonably convincing evidence, but it's only correlational. There was no manipulation of arousal, so to speak. And so what he now did was to strengthen the argument, to strengthen the case for the over-arousal hypothesis. What he did now in another experiment was he actually changed the amount of nervous system activation, the amount of sympathetic arousal in his older participants, by giving them a drug called propranolol. And what propranolol is, as you can see down here, it's a beta adrenergic blocker. It suppresses activity in the sympathetic nervous system. And when he did that, he found something quite fascinating. He found, as you look from the previous slide, see the older person's arousal was high and their performance was low. What he found is when he gave them the drug propranolol, it reduced their level of arousal. They moved from this part of the curve more towards the sweet spot of the arousal spectrum. And simultaneously, the performance went up. There was still, their average was slightly less than the young people, so to speak, but essentially much of the age-related decrement disappeared when he modulated the overarousal, when he mitigated the overarousal. And this is pretty compelling evidence for the arousal hypothesis. Another researcher actually showed us how we could apply the overarousal hypothesis by, instead of using drugs, which would be a little bit overkill, to say the least, of going around giving older people drugs to calm down their, if you will, overactivation. In the experimental situation, Ross asked the question, could we mitigate the overarousal through some sort of situational calming, through some behavioral mechanisms to reduce arousal? And so what Ross did was devised an experiment, a learning experiment, where the arousal of young and old participants was manipulated through the settings that were established and through the instructions. And in these three different conditions she looked at, there was either a supportive setting where the instructions were very calming and that it was not highly evaluative and that put people at their ease, versus sort of the typical neutral type instructions we see in an experiment, and then throwing a little bit of gasoline on the fire of overarousal. Ross set up a situation that was very challenging, and so those instructions in the setting was designed to exacerbate any overarousal that might exist in the older population. And when she did this, following the hypotheses that were made, what we see is that when we use calming supportive instructions, we can minimize the age difference. And when we use challenging instructions or environments, we can maximize the age difference. So this idea that the size of the age difference in learning can be modulated by how much you behaviorally, if you will, change the level of arousal in the situation and in the individuals in that situation, that this is highly consistent with Eisdorfer's over-arousal hypothesis. So up to this point, we have considered two of the three modulating factors that can influence age differences in learning performance. We've looked at pacing effects, we've looked at situation-specific arousal, and now we need to consider the influence of stimulus meaningfulness. Barrett and Wright, a couple of researchers from the University of Akron, postulated that stimuli being used in verbal learning studies could have cohort-specific meaningfulness. By that, they meant that lists of words could be compiled that might be highly meaningful to young people, let's say college students, but not so meaningful to older people. And that's important to consider because it's well known that stimulus meaningfulness of verbal materials is a very, very important predictor of how easy it is to learn those materials. So if Barrett and Wright's conjecture was correct, namely that in many studies, the words were more meaningful to young people than to old people, then perhaps a significant component of the age-related decrement in learning we see in many laboratory studies was due to, if you will, this age by cohort confound in the meaningfulness of the stimuli. So they devised a very clever experiment to evaluate the potential significance of this problem. What they did was they did a learning study where they not only compared young and old observers, but they also compared the learning performance for lists of words that were either young words, that is, words that would be highly meaningful to a young cohort, let's say of college students, versus a list of words that would be much more meaningful to, let's say, a 70-year-old cohort than their 20-year-old counterparts. And in fact, the list of words they put together, their so-called young cohort list, is this first column in the slide I have presented here. And then we see that there's a second list of words. Those are the old cohort words. The words in the first column were more familiar to the college students of 1980 when this study was done than the list of words on the right. And the list of words on the right were more familiar, if you will, meaningful to the 70-year-olds or more in the study done in 1980 compared to their young counterparts. So what happens when you not only vary the age of the learner, but you vary the age of the words? And at the same time you're varying the age of the words, you're implicitly changing the relative meaningfulness of the words for any specific cohort. Well, what they found was actually quite a profound outcome. Let's take a look at their findings here. Remember, this is performance on a learning task. And when young people were given a learning task using young words, they did very well. But look what happened to the performance of the young people in this black line when instead of using words from the young list, they used words from the less familiar, less meaningful old list. Their performance dropped dramatically. And similarly, when we look at the older participants in the study, when they were given words to learn that were from the young list that were less meaningful to the older people, they did quite poorly. But when the words were switched to older cohort or older words that were more meaningful to 70-year-olds, their performance became significantly improved. In fact, what we see in this study is a complete crossover effect, a reversal of the direction of the age differences in learning. When the stimuli were highly meaningful for young people, the young people outperformed the old people. But interestingly, when the stimuli were highly meaningful for the old people, but of low meaningfulness to the young people, the old people actually outperformed the young people. So this is a pretty dramatic effect. And it shows how stimulus meaningfulness is a very, very important factor, and it needs to be considered in learning programs and learning strategies for not only old people, but for all people. So I want to end this lecture by considering some work that's been done in the past to try to come up with training strategies, if you will, interventions that can help people who are having learning problems or memory problems, and maybe help them mitigate those problems by using some sort of cognitive interventions. And there are many projects that have been completed in the last 20, 30 years that have attempted to come up with strategies, training programs to help older people, particularly older people who have mild cognitive impairment. They're not demented, but they're beginning to slip a little cognitively. And various techniques have been used, things like forming visual images to help remember, certain mnemonic devices, other types of memory devices to help your memory and to help you learn relationships more easily. And in the laboratory, clever researchers have found very many different types of techniques that can be used to help boost learning performance in older persons and boost their memory performance. But they all run into a universal problem. And that is, despite the fact people can use these strategies in the lab and get better performance, when they're in the wild, when they're outside of the laboratory and they're participating in their daily tasks of living, their everyday lives, they almost never, ever apply these techniques or strategies that they've learned. They just find them too effortful, too awkward. And so as a result, you might be able to show that certain training programs are efficacious in the lab, but in terms of application, they kind of fall flat on their face. And that's a pretty consistent finding we've seen in training study after training study. However, in the last few decades, some really interesting observations have been made, and that is that older people show robust learning capability through observational learning. That is, that form of learning sort of first carefully researched by developmental psychologists like Albert Bandura, that show that we humans are well equipped to learn just by watching other people do things. It's sort of vicarious learning through observation. And it turns out that older people can learn very, very well through observational learning, what's called modeling. And that's really important for us to consider in this day and age, because now we've got technology and databases of things like YouTube that literally have millions and millions of how-to videos, how to learn this skill, how to do this type of procedure, so to speak. And it's been well demonstrated that older people do well with these types of modeling approaches. So this vast array of these videos that are now available to us, these packaged materials with built-in modeling, observational learning power, available to the masses, this is going to be a boon, I believe, for older learners in the future. And I believe we'll see more and more and more reliance upon these online modeling-based learning approaches in the future to help older folks and younger folks as well.